Dry needling is the use of these needles. They're very similar to exactly the same needle as an acupuncture needle, but it's the way in which that they are used that varies to acupuncture. It's a therapy that's incredibly effective for relaxing hypertonic muscles. In dry needling, we address this tension by locating certain trigger points inside the muscle, and so at these points, if with a correctly placed needle, it sends a signal back to the brain that inhibits the signals coming down that's telling the muscle to maintain a certain tension. So it effectively turns off the signals that are telling the muscle to be hypertonic, and so it's an incredibly effective therapy for all sorts of sports strains or muscular strains, and it's also great for tendonitis because it really kickstarts a healing and regenerative processes inside the tendon. Dry needling is a relatively new therapy it's been used primarily at the moment by physios and osteos and chiros. It's purely a muscular therapy, so it's purely addressing muscular tension and dysfunction. Chinese acupuncture is a much more holistic system in which they use an entirely different method of diagnosis and treatment to decide which needles need to go where and the amount of time that they need to be left in for. It's a much more focused on the visceral aspects of the body as well, so the function of the digestive system or the respiratory system and things like this, whereas dry needling is purely a muscular therapy, and it's purely used to relax certain muscles or to stimulate some sort of healing response in an aggravated tendon. So the points that we use in dry needling are different to those of acupuncture. We just simply use the same tools. The needle is a hair-thin needle. I've got one here. You can't even really see them. Here, it's hair thin, and the length varies depending on the site of on where you're placing the needle. So you can get some long ones that can go in right into the glutes if you've got really tight glutes, or really short ones that can go into the forearm here if you're getting some sort of RSI at work or something like that. No, it doesn't hurt. It's not an incredibly painful therapy at all. It's not like going and getting a blood test. You can't even really feel the needles going in. We give it a little flick and it goes through the skin where all the nerve endings are. And once it's through there's no nerve endings to stimulate to say, ow, there's a needle inside me. It's purely just the muscles, and we're going purely for the hypertonic points in these muscles. So sometimes when it goes in, if you hit the right spot, there's a nice twitch response, and that's the message that you can feel being sent up to the brain. So this twitch response is the one that we're looking for, and it's not a pain as such. It's purely just like a little flick of the muscle. The muscle just gets excited very quickly and then relaxes again. Dry needling is a very effective therapy for releasing hypertonic muscles. It can be much faster to put 4 or 5 needles in there and leave it for 5 minutes rather than go through for the full half hour and be giving you a vigorous massage to get the same results. It's much more rapid and comfortable therapy to have than a deep friction massage or a deep tissue massage, especially in through the shoulder blades and the glute areas. It can get just a much deeper release than because our hands purely just can't get into the tissues, into those deep tissues and muscles that we're trying to target. No, in order for an osteopath to perform dry needling, they need to have done some sort of postgrad study, and so a certified course with certified trainers